Good afternoon, everyone. Really excited to have this amazing conversation today with someone that I respect and revere and just honor the service and labor of love and the tenacity that she brings to being the Chief Medical Officer of Cover California, Dr. Monica Soni. We're going to be talking about just her groundbreaking program that Forward had the honor to partner with Cover to deliver for Californians. But first, I'd love to just extend the floor to Dr. Monica to just share a little bit about her background and then anything else you'd like to share before we get into our conversation today.
Thank you. Thank you. Well, it really is a pleasure to be here with folks, and I'm looking forward to tough questions about the program. As mentioned, I'm Monica Soni, the Chief Medical Officer at Covered California. I'm a primary care doc. It's probably one of my more important identities, and have been in this role in this capacity for the last couple of years, which is really an honor. We support over 2 million Californians across the state and really work in partnership with other public purchasers and state agencies to improve the health of all Californians. That's actually our vision and what I get out of bed to try to do.
Wonderful. And as Dr. Soni said, she served as a doctor prior to her serving in this role. And so, really, one of the things I appreciate about you is just your approach to total care and health for humans, which is really exciting. And I'm excited to jump in today. But before we do that, for those that don't know me, I'm Asia Brown. I have been a public servant for 20 years. I started out as an urban planner, economic developer, served throughout my tenure for almost 20 years in administration. 8 of those years, I served as mayor of the city of Compton, excited to just be a catalyst of impact in communities, focusing on growth, equity, health, wellness, and all of the things in between, and excited to lead impact with Forward and delivering solutions that I wish I had when I worked in government, and helping to do just excellent work and empowering wonderful administrators that are committed to serving people and communities with just first in kind tools to make that easy, powerful, and effective. So excited to just share about the wonderful intervention and service of health that we were able to deliver in California. Okay, so my first question for Dr. Soni is the why. Can you tell us really how Cover California, a medical provider, decided to step into the space of guaranteed income and really just a multitude of health interventions? Could you talk about that?
Yes, absolutely. We really had a very unusual opportunity. We had a accountability program for all of our health plan partners to assess how were they doing on quality. And there were direct and substantial financial incentives for underperformance on those measures. And, we wanted our plans to succeed. We want the quality of care that is received for all of our Californians and members to be excellent. But we suspected, some folks had a long way to go. We suspected that there might be some funds collected from underperformance from health plans. And, the part that was amazing is I have a fantastic boss, Jessica Altman, shout out to her, amazing legal counsel, a board that's super supportive. And so they allowed us to take an opportunity to think about, wow, we might have millions of dollars that aren't yet earmarked. What could we do that is new and different? And of course, we did deep literature reviews. We talked to experts across the field. But the most important part, I think, for us, the kind of the pivot point, was that we decided, let's go talk to the people that we serve and ask them what is getting in the way of their health and wellness, what is supporting their health and wellness, what could they use more of. And that was sort of the genesis of the idea. What we heard back directly from thousands of our enrollees helped shape the population health investments that we're going to talk about today.
That's really exciting. And really, it's groundbreaking. I just want to take a moment to pause there. This is the first intervention of its kind in the United States where we're taking money from healthcare industries and repurposing those funds toward areas with the greatest need back to those that pay these premiums. So that's very, very powerful and avant-garde. And just kudos to you and your leadership team for taking this bold step.
Thank you.
Um, Yes. So, as we get into some of the details from the policy lens, could you share maybe some of the challenges or disparities that you and your team were focused on really addressing with these interventions?
Yes, absolutely. So as I mentioned, we wanted to really hear directly from folks. We didn't want to have intermediaries, and but we did know that there are many folks across the ecosystem that had a perspective on this. So we listened to consumer advocates, we listened to the health plans directly, we listened to the physicians and practices that were serving our members. And then importantly, we actually cold called hundreds of Covered California enrollees who do have chronic health conditions and for whom we had this, sort of underperformance from health plans. And then we sent out surveys in multiple languages as well. And what we got back, particularly from our enrollees, frankly made our jaws drop. We had not been asking maybe in quite as fluid of a way what the challenges folks were facing were. And I'll share one data point which we knew that maybe raised our spidey sense, which is we do an annual member survey and over 47% of all of our new enrollees were saying that they felt like they didn't have the financial means to kind of make ends meet, to make ends meet. That's a lot. Like, and the number went up, right? We're approaching 50% of folks saying that they are in financial distress pretty much. So when we started to talk to folks and survey folks kind of that next level down, we were hearing about enormous amounts of food insecurity, higher than anything I've ever seen published, higher than anything I've seen in other lines of business, including Medicaid. And again, we're the exchange, so we're kind of the folks that don't have Medicaid because they are a high enough income and don't qualify for Medicare because of age and they don't have insurance through their employers. Overwhelmingly food insecurity, and then whole host of other challenges, transportation insecurity, just doing tough rationing. If I go to a grocery store, that has healthier foods, it's far away. Do I have the gas money to actually get back after I have bought those groceries? So that immense set of like dollar by dollar budgeting was what we heard from folks and made us think differently about what could we do with funds. Was there an opportunity to put it back into the pockets of our enrollees and to give them that breathing room that they were asking for? And so I think that was some of what we were hearing, both quantitative and qualitatively.
That's such a really powerful point of data and really a reflection of, unfortunately, just the environmental conditions that many people face, and even in the state of California, where the working poor, they make just enough to not qualify for food assistance programs, and they don't make enough to really cover just a healthy just food design for their families. And so that is a huge population segment that I think many times is forgotten in the policy space because we're either focused on, those that really are very much have a significant need, and then, not thinking about those folks that are a part of just the contribution to society economically, but that they still are stretching to make ends meet. And it very much met the profile of my mother, who worked full time my entire life, retired from Jet Propulsion Laboratory, yet we struggled with food and things that we needed, but didn't qualify for aid programs. And so just sometimes literally $1 will push people out of qualifying for those programs. So this program really has stepped and filled in the gap that many Californians are facing just quietly, still going to work, still doing the things that they need to do. So this is really groundbreaking. Excited for the data and the policy pieces that will come out of the research so that we can do some more interventions. um,
Well, thank you for that story. I think it's
yes.
exactly right. And you use the word quietly. And it just really resonates with me. When we talk to folks, folks were not angry. They were not advocating for anything, but they were so open to sharing their stories. I mean, this was the part that was so fascinating to me was, we're cold emailing and cold calling folks and asking them about like intimate details of how are you managing your day to day, your week to week, and your month to month? Do you have childcare? Are you getting these benefit programs or not? And folks just of their own accord just sharing with us, like we're really struggling. I have childcare covered, but I don't have these other pieces covered, and utilities went up and my rent went up, and now I'm not really sure how to continue to balance all these pieces. The How forthcoming folks were, I sort of suspected it was because nobody had ever asked them. I mean, a little bit that was my worry, was we had this blind spot as a society, and at the first opportunity, folks were willing to share their lived experiences.
So powerful. And I want to highlight quickly before I go to the next question just how intentional you and your team were with designing outreach in order to really hear from the members what they needed and thinking about the best way to reach them as well, to really let their voices be heard and included. So just really powerful work that you all have done. We talked about food insecurity. I would love to hear about the additional interventions that you all designed.
Yes. So we had a set of guiding principles, and our guiding principles were, of course, equity, equity first, equity centered. But we also didn't want to be redundant to what else was happening across the delivery system. There were amazing programs in community, of community, in government, and private sector trying to support folks. And so we weren't trying to be redundant to that. We wanted to be kind of additive. We also know that there's been some amazing studies that have shown kind of seedlings, right, of things that maybe hadn't been fully scaled. And so we wondered, could we actually do something new by taking something we've started to learn and maybe trying to scale it across the state with our huge footprint? So that was the guiding principles was really important. And then, we wanted to think differently about population health, right? We talk about health and wellness. Well, it's not just meeting someone's needs today. How do we actually move all the way, all the way, all the way upstream so that potentially we can avert the situations that we're trying to put band-aids on right now? So that led us to, the next one of our population health investments, which is actually early investments in children's health and wellness, and it's money into child savings accounts. So for all of the kids uncovered California, and again, we already know kind of working poor families are kind of struggling to keep things together. And for all the kids who are 2 and under, uncovered California, we're putting up to $1,000 into the Cal Kids Child Savings Account, which is a statewide program from a sister agency. And the reason why, the connection to us to health is this. We know from the studies, maybe many of you on the call know, when there's even just $500 in those accounts, the likelihood of going to a 2 or 4 year college increases substantially. And I've heard folks describe it different ways, but the way that I internalized it was it's actually hope. All of a sudden you have this, I'm potentially college bound identity, and you hope for a different life than maybe you are currently living. And we know that when folks have educational attainment, it leads to income attainment and ideally wealth attainment. And that changes your health more than almost anything else that we do, particularly in the delivery system. So I just felt so strongly that could we at least do one thing that's way upstream that maybe changes the life course for some of our babies?
Just so beautiful. And just the intentionality, once again, thinking about the holistic journey of someone in a family's wellness and their trajectory, which is not an instant outcome. And so that's just very, very exciting to hear about that. And just internally, we know that for Cover California land, these interventions, we call them poppies, but they really are a population health investments. And so that just really speaks to the intentionality of and the thought continuum that your team really approached these investments in California families. As we go to just some of the kind of the implementation phase, talked about the impetus and the design. Could you just share a little bit about how you navigated from vision to implementation? I mean, when we think about these major health intervention investments there that you were intimately a part of driving the design of the things from data collection and all of the touch points. Could you just share maybe specifically, maybe you can take a piece of it, maybe like from the grocery support program or anyone that you would like to highlight? Just how does that vision come into implementation?
Yeah. I mean, I think one part was, I don't know if it was ill guided or just dogmatic, but just like faith that we could do it. So, Cover California had never done anything like this before. No, certainly no state-based marketplace or any exchange. And frankly, really no purchaser had really rolled out a program like this. There are benefits, right? There are some health benefits that get kind of baked into what you get from your insurer, but there really wasn't an equivalent sort of program where directly we were going to dictate how the program was built from the ground up and going to track outcomes and going to have an evaluation strategy to make sure that it was doing what we needed it to do. So that's one thing, was just sort of like faith. Like, we're going to do this and we're going to do it on time, but in a way that centers our people. Amazing teamwork, right? Like, we're not a particularly big division, the division that I'm a part of that I run. but folks just were committed. And so, whether it was thinking about how many characters we were in a text message, or, how do you roll out an IVR? What is the experience on a platform? There was no detail too small for anybody on the team. And that includes your team, right, Asia? The forward team was so important. And when we were deciding who would be in lockstep with us, who would lock arms with us, that was the most important part. Where would there be fidelity to our vision and commitment to it, and a willingness to do something new and different? If we collectively agree, like, this is the right thing to do, we're going to find a way to do it. So team, and our team internally covered California, and then the expanded team. And then I think a little bit of, like anything in implementation, you have to be a little bit flexible. Sometimes what you think is going to happen doesn't quite happen, but clarity of the endpoint and clarity of what success looked like. Maybe the road was a little bit windy, but we knew what we wanted, again, enrollees' experience to be. We wanted it to feel seamless. We wanted it to be in the languages that they tell us that they spoke. We wanted it to feel accessible. So when we had clarity of that vision, like how we got there wasn't negotiable, but not, again, that endpoint. So I think those are sort of the parameters which helped us move into implementation. And then a lot of hours. I mean, there's a lot of hours.
Definitely. Can I ask you just relative, and you mentioned just, the boldness, the being committed, and then flexible, I think is just so powerful as well. When you think about the design and the implementation of those various streams, because it's, there's in the GBI world, it could be very simple, just giving cash to someone or a family. But with Cover California and your design, it was really about these very specific interventions that really met a very isolated population. Um, what was your approach in terms of navigating with a partner to really ensure that your policy objectives were implemented? Because there's big vision, there's doing the kind of the new thing and breaking ground, and then it's how does that actually roll out into an actionable experience? Could you just maybe highlight some things that were unique or that you didn't expect, or something that would be helpful to those that are thinking about doing something groundbreaking?
Definitely. I think some was because we were doing something new. There wasn't a single fact base, right? It wasn't that we knew exactly what was going to happen. And so I do think we were transparent about that, especially with Forward, where we said, here are the closest that we have recovered California experience to approximate what we think will happen here. What do you all know, right? Bring your fact base forward from your past experiences in implementing super large programs and disseminating funds, again, also at scale in a rapid time frame. And how do those facts, when do they clash, right? When are they complementary? And can we design thinking about what we know, but appreciating that there's a pretty wide margin of ambiguity of things that just we're not sure about. And so I think when we were just honest about it, we weren't kind of puffing ourselves up and like, oh, it's going to be perfect. There's not going to be any issues. Like, we're like, well, we don't know. There might be issues. There might be things that we kind of crash on. It allowed for more space to say, okay, let's build in plan B and C at the same time. If this happens, then this will come true. If this, goes well, fantastic. We don't need those backup plans or that safety net. But if not, we're prepared for it. So just to be tactical, right? We thought a lot about, we have members who don't have an email or a textable number. Like, they only have a telephone number. And we just knew that that's a different subset of the population. They're going to engage in this program in a different way. How do we design for them first and with them in mind? So they went earlier. They got the inbounds first, right? We thought a lot about, what does the voice sound like? I mean, frankly, I did some recordings, right? I was like, this is Dr. Monica. This is not a scam, right? Like,
Yes.
just experimenting. But again, with this appreciation that we don't really know, like, let's give it a try and let's name it that we don't know and we're trying something new together.
Yes, I appreciate that. I remember listening to those IVR samples, and shout out to the forward team that has just been extremely nimble and strategic and flexible as well with providing solutions. It's exciting just to, on the other side, once you're going through this process, it doesn't feel glorious, but on the other side, when you look at the impact and what has been built as a result of just innovation, then it's all worth it. Hopefully the operations team feels the same. Could you share, and I know that this is very much earlier in the program and maybe qualitative data hasn't surfaced yet, but is there any just kind of maybe surprises or just data that you all have received? And you shared a little bit about from the food insecurity from members, but is there any feedback relative to some of the other poppies that were surprising in terms of from a data perspective?
Yeah, I mean, probably not surprising, but maybe remarkable. We sent out, again, we were trying to legitimize or credential the program so that folks wouldn't think it was a scam and ignore it. And so, as part of that, at Forwards urging and advice and from learned experience, there was an email that went out just to say, hey, in a couple weeks, you're going to get, a text or an email or phone call. It's not a scam. It's coming from Covered California's program. We think you're eligible for these funds. And immediately, it was not meant to be bidirectional. Immediately, several folks responded to what was essentially like a primer informational email to say, this is amazing. Thank you so much. Can't wait to look out for it. I'm eager to be involved in the program. And that, frankly, it surprised me. I mean, yes, we had been talking to folks and we knew that there was a lot of demand, but we weren't really sure what the recipient experience would be yet, right? To get these inbounds saying, hey, we have $1,000 for you. Like you could easily be like, scam, scam,
Right.
scam. So I think that immediate like receptivity helps me feel confident that we were going to encumber all of those funds and going to be able to do it in a rapid manner. And, essentially in about a month, pretty much, we were able to encumber millions of dollars for folks that were food insecure across the state. And folks are using those cards already, and so just for the specifics of it, it's that, right? They're getting a reusable debit card that can be used at, food retailers and grocery stores, and it's scaled for their household size. And we're already seeing that folks are getting their groceries from Costco almost immediately as soon as it hit their hands. So I think that's sort of for me, was the surprise is that we really didn't have friction, particularly on the food side. I think on the kid side, we're still learning. We're very early on in that implementation. Families are very responsive. But if you remember, these are families with kids who are 2 and under. Some of them have newborns at home. Like they have a lot that they are balancing. And so we're just one priority amongst many for them. And so I think it's a different game. It's a little bit of patience, support, reminders, helping folks access the resources and saying like your child savings account is here, like we're also ready to catch you whenever you're ready to engage with us.
Dr. Soni, you touched on quite a bit. What I'll highlight the swift rollout and just shout out to the forward team for the success of that. But then being able to really see in real time how people are using their support is also a powerful piece. There's always just kind of misconceptions or just questions about how people use um, money, but data overwhelmingly reinforces that people use support for the intended use, which is to support their family. So that's exciting to just add to that body of data quickly. And then relative to just if you can go a little bit deeper into the child savings account. So I know that the simple high level is that you're providing an investment to the future of children and families. But could you just share how does a family qualify for that benefit? And I just know that it will unveil another layer of intentionality of impact. So if you could talk about that.
Definitely. So on the food side, because of the data that we had, we did have an income kind of filter. So if you were a family with an income level of 250% or less, you were on our kind of top of funnel. If you had a chronic health condition, you were top of funnel plus income. And then we asked folks for food insecurity, and then they could, be eligible for the program. On the kid side, we have no income funnel, right? So any kid on Covered California 2 or younger is eligible for this program. And that is because that's how the state program is structured as well. The Cal Kids program is income agnostic for newborns. And we felt like that made sense, right? We have no idea the trajectory of this baby's life, right? We want them to have all of the things that they can have, achieve their highest health and wellness. And so let's start with the data that suggests that you could do that. So there's no income filter. There's just the age criteria. But the one thing that we were trying to amplify was that the health of kids in California is quite bad. We actually have been scored 50th on a few measures for children. And that's shocking. That's so shocking. And it's going into their preventive care, getting their wellness checked. And then the rate of receipt of vaccines, recommended, guideline recommended vaccines, has continued to go down after the pandemic and has continued to worsen year over year. So we're on the health side. That is not, those are not metrics of success. If you think that our future is predicated on the health of our kids, you got to address the health piece too. So we were thinking about if you have a baby at home, you want them to be healthy, you want to protect them, you want to invest in their future. Could we fuse these things a little bit more? So essentially, our extra $1,000 functions like an incentive. You're getting those well child visits, you're getting those recommended vaccines, the money hits your account, and it's a bit gamified. Every time you hit another step or milestone, bing, like you get more money. We're not being super restrictive, but we are doing these reminders in advance. Hey, your 2 month visit's coming up, your 4 month visit's coming up. If you got it done, just let us know, and the money will transfer right over. We also know that just from the data, actually having the kids get their flu shots is where we really fall off. It's one of the lowest received immunizations. So we put extra money on that one. You get a whole extra set of funds just for getting that flu shot, trying to be responsive to what we know the truth of folks' experiences and still try to support those health seeking behaviors. So it is about the wealth acquisition, it is about higher education, but of course, it's all also about health and wellness and preventive care.
So just strategic, and I'm excited to learn about just the outcomes that were really incentivized because of the financial incentive to families and for folks that have been a part of bringing new life into the world. And people are in different stages and dealing with different experiences, but knowing that you can make a wonderful investment in the life of your child is really an awesome incentive to make sure they get the care that they really need and deserve. So kudos to you all once again, just designing just a really powerful and intentional intervention to drive outcomes that we desperately need. We to be 50th in the nation is an unfortunate statistic, but I'm hopeful that evidence-based interventions that are thoughtful and very much thinking about whole health and prevention can continue to be leveraged to drive better outcomes. And that being said, I would love to just take a moment to take a step back and look at the broader picture about what this really intervention and new prototype means for health. And when you all and really your leadership and vision, Dr. Soni, thought about just the intricate design of this program intervention, you thought about scalability and replication. I'd love to just ask a couple of questions about that as well from a policy lens. And you're very unique in that you also have the medical practitioner lens. What is your thought or just your analysis about the opportunity to use health investment interventions to help drive greater outcomes in the policy space?
Yes, I think those of you on the call are, you Asia know that there's a lot of money in the health sector, more than there should be, frankly, because we're not preventing, and we are taking care of some potentially preventable costs. And so I do think, frankly, the onus is on us in the health sector side to think about how do we reallocate some of those funds and redistribute some of those funds to things that are shared goals. And we do have to be willing to sort of open up the purse a little bit. And I think that's one takeaway, right? So many other folks have quality programs, equity programs. There are even financial incentives at the health plan level, at the delivery system level. It is less clear and less common that those funds would ever go back into societal wide, community wide, even individuals directly. So I guess I would say that's one potential takeaway is one, just that we did it. Separate from the outcomes that it could be done. You can take money from over here and put it over there, and you can do it in a very short time period. I mean, for us, it was 14 months from idea to working through stakeholder engagement to going through our board to implementation. Pretty much that was it. It's incredibly quickly. And we're a state department, right? So we've got all the bureaucracy of everybody else. We're not, some startup. So that's one, like it can be done. I think the other piece of it that I think I would love to see scale is the listening, right? Like it is hard to do co-creation. It is hard to power share. That is true, particularly when you are a large state agency or any large organization with a huge footprint. I mean, the differences in our population from the rural north, to Los Angeles to the border are substantial. So, to be intentional about, well, how do I get as many voices as possible? And we didn't talk about it, but after we did all of the listening, we had a public advisory council, which included a current Covered California enrollee. There's someone from CMMI, there's a health plan person, there's a doctor, and then there's a current Covered California enrollee as peer sitting there to listen to the ideas and give us feedback and tell us yay, nay, or that's the wrong direction. So that is scalable, right? I know that we often have kind of patient advisory councils but they're sometimes siloed. They sit over here and they're not integrated with the real decision makers. And that was not how we structured it. Our enrollee was a decision maker along with the other council members. So I think that's scalable. I think the other part that was really, I think is pretty slick is the platform that Forward built for us. It is very human centered. We thought a lot about the language that was used. We had family advisory councils reading our scripts to make sure that it felt accessible. Every word we obsessed about, frankly, all of us together. We did it in multiple languages easily. We leveraged, AI where it was appropriate for some of that. We used text, phone, email. We used all the modalities. I mean, that is scalable too. Like, can you design programs not just for the ease of those who we know can enter, but for the folks that are going to have the most challenges? And we weren't perfect. I mean, as we start to look at our data, we know that it wasn't totally equitable. There are folks that we just still struggled to enroll, but we did design thinking of them first, even if we weren't entirely successful. For example, for the phones that had phone line only, it was much harder to reach those folks as it was someone who could take a text or an email. Yeah, there's so much I think to continue to unpack as we learn
Yes.
more about it.
You dropped so many gems and really a playbook on how to just roll out something groundbreaking and be successful and to integrate just real voices and experiences and perspectives to deliver a holistic solution that really meets people where they are, and that very much accomplishes the full scope of what the objective truly is and can be. Being able to deliver something so robust and intricate in just 14 months is also just groundbreaking. And I love that you highlighted, you took the onus away from folks who are like, oh, I work in government, just so much red tape. It's just like, listen, Cover California is
We
like
did
the
it.
Titanic. So they're the red tape state agency. And yet they were able, through your leadership and tenacity, to really, tear down these walls and silos and to really deliver something just really monumental that has really, I believe, changed the landscape of health for our nation. And I'm just really excited to see what shifts come out of care because of the data that you all have meticulously designed to capture. And really, beyond the data, it's the impact that you focused on first, and then being able to collect that data second to do more of this work is really where the scalability comes in. Are you hearing like rumblings in the health space about doing things differently? Because it's hard for government to change. Are you hearing anything about just a new perspective in driving outcomes? Encourage us today, Dr. Soni.
Okay, I'm going to be encouraging.
If
I'm
you
gonna be
can.
encouraging. Well, yes. And here's
Okay.
going to be what I think could be a silver lining. It has been a long time, frankly, since the language of health and wellness, and I'm going to use another word that came to us from CMS, happiness. Like the happiness of the people that we serve was actually something that was like proposed to us in some revisions of quality measurement. It's been a long time since we actually cared about the happiness of the people that we are serving. That could be an opportunity for us.
Can I
I
just
think
interject really quick?
yes,
Happiness and joy is something that is a part of equity. Everyone should be able to enjoy
love it.
just being able to smile and breathe. But I'm handing it back to you.
I agree. I feel so strongly about that, and I agree about that. And I think we talk about it sometimes for ourselves, but do we talk about it for the folks that we serve, right? Like we actually want you to be joyful and happy in your life. I'm going to be honest, that is not language that most of my career has ever been used, and here it was coming to me from DC and CMS. And that is I'm gonna celebrate that, right?
Yes.
I think there are things that we can challenge ourselves on in the health industry. And I have to say, I think our program that we've designed, the Population Health Investments, is an example of that. We're taking money and putting it all the way over there for the health, the wellness, and yes, ideally the happiness of the people that we serve. So maybe I think if we as a collective decided to try to find the opportunities within the challenges that we're all facing, maybe there might be pieces of this ecosystem that turn out better than worse. Is that hopeful?
I'm encouraged because you've proven that it is possible
Yeah.
for a governmental agency to
Yes.
prioritize the happiness, the health, and the future outcomes of
Yeah.
families using a direct intervention and investment of funding. So it's possible. So thank you for that. I'm encouraged. Um, Dr. Soni, so I know we're almost going to break for a question. So folks that are with us, feel free to just drop some of your questions in the chat. We'll be able to just integrate you into the conversation shortly. As we wrap up, Dr. Soni, from this segment, just a couple questions on just personal reflection, just
Sure.
your leadership style. It's no small feat to really just earn and deliver and
Mm.
prove and just be able to matriculate your way as the chief medical officer of Cover California. So, and this is just an internal joke that I want to share with you all. So, Dr. Soni is a friend. We've grown to be friends during this process. You know, you're in the trenches with folks, you become closer. But I just have such an admiration for her as a woman, as a woman of color as well, to be able to operate at such a high level in this role, and then to be able to really break barriers and to drive just better outcomes for everyone. And I think that's such a powerful point, even in the time that we're living in. And I just want to put a point for Forward. Forward is a company that is almost 90% women. Shout out to the women of Forward. That's so
Go.
unique, especially in the tech space, to that
Hmm.
85% of our team is actually women doing this awesome work. So in that, yes, in that, could you just share as a leader that we revere, working in the intersection of medicine and health and policy, really just what continues to drive, what is your continued North Star about the work that you are committed to doing?
Yeah, I think I love the phrase North Star. I've always really found that to be helpful for me. And, you don't always have a choice. You don't always have a choice about how you have to do things or what you have to do. But if you even see a tiny sliver, a tiny sliver of
Twinkle.
opportunity, edge yourself all the way in. And I feel like that maybe is one of my superpowers. Like I'm always going to do the job as I'm required to do it, but I am forever scanning, right? Like, oh, is there an opportunity? Oh, I heard something over there and I heard something. You are definitely like this, Asia. Can I put these things together to make something new or distinct or amplify it, whether or not I'm part of it or not? Like, can I just be, a mechanism? And I feel like that was what this was. I was only a few weeks into the job and with tons to learn, tons to learn. And as I was thinking about it, I was like, gosh, like, could we do something different? And I went to my boss, I said, what do you think? Could we do something different? And just to have her support, another woman, have her support immediately is to be like, yeah, if you can figure out how to do this, you have my support. And then I was just off to the races. So I think, knowing what your North Star is and then looking for the opportunities to sway people, organizations, funding, anything, towards that, to me, that's the most important way because then it helps me live my values, right? There'll be things that don't, but when you have done that, it really helps you live your values.
Thank you for sharing that wisdom with us, Dr. Soni. And I want to just highlight a couple other things that I see in you that applies to this arc. Number one, you were, as you shared, you were just a couple of weeks or maybe even that into your new role, and we're finding ways to just like stretch limits, take the limits off. And most folks, they would get into a role and just look around and say, let me turn the lights on, let me just see what's going on around here, and not, rock the boat too much. But you came in, turned the lights on, and said, okay, how can I take the roof, the ceiling off of this place, and then let me get coverage from the person that brought me in, we appreciate and salute her thumbs up as well to let you have room to be the avant-garde that you are. But that's rare because many times people will choose comfort or
Mm,
fear over just innovation and
mm.
doing new things that take risk. So those are really powerful points that I see in your leadership. So thank you and salute. I would like to just wrap and close here, and this is where you can just motivate the masses. For those folks that are in the trenches, the public servants, the advocates, the service providers, and they are desiring, working, just pushing in their own ways to move the needle on wellness and health in their spheres, their metrons of influence. Could you just give them a point of motivation that they can take back with them and keep doing this work? Because we need them. Yes, yes.
We talked about it a little bit, but maybe it sounds cliche now, but I'm going to say it anyway. I feel like there is so much joy in that work, right? I'll like recount what I think we've done together. We listen to folks suffering, and instead of letting it paralyze us or weigh us down or incapacitate us, we were catalyzed by it. And there are now thousands of folks right now across the state who have a little more breathing room, who know that somebody heard them and responded to their needs. And that's joyful. I don't know, like that is turning suffering into action. That feels joyful to me. And I know you all are doing that every day. And I'm grateful for you all for doing that every day. And so I think, I'm a primary care doctor that I've been firsthand witness to so much suffering for so much of my career, but that has never burnt me out because part of my responsibility has always been to see, can I lift it a little bit? What tiny bit could I do that might alleviate the burden? And so now we have the opportunity to do that at scale. Man, that makes me feel happy.
All the joy and all the things. It's worth the labor of love to be able to meet people and see them and support them. People, humans deserve that. So
Yes.
I just want to thank you for your leadership and the impact that you've made through your organization and our partnership that we value so much at Forward. It's just been one of the highlights of just our time in the marketplace, of being able to partner with you all for such a not just a large scale groundbreaking program, but it's intricate and it's difficult and it's beautiful and it's impactful. And so it's been a wonderful journey. And Forward has made the better for it because we've innovated in ways we hadn't before to meet these objectives of the poppies and interventions. So it's been a joy, and we love the Cover California team, and look forward to doing more of this work in the years to come. I will break now to just answer any questions or take questions for the audience. I'll navigate to make sure I can see the right chat. So this is a pilot. What's next for Cover California, Dr. Soni? Inspire us some more.
Well, so it's a great question because one of the interesting and challenging parts is, as I said, the source of the funds was from underperforming health plans. And that's not meant to be a sustainable revenue stream, right? We actually want plans to all be performing really well and to be high quality, and therefore we don't collect any funds. So, that led to some challenges. This isn't something that we're going to be able to sustain for thousands of folks year after year. But what I think is so important about our design was that embedded in those two population health investments, we actually put randomized controlled trials in there, right? We didn't even talk about that part, Aisha, which is we have a comparison arm, not placebo, but a comparison arm built in so that we could learn about impact. So we've got amazing evaluators from UCSF Siren team and UCLA academic evaluators. We have, for the food intervention, our baseline survey completion rate was over 70%. Folks are giving us the data, right, to learn. So what will come next is some of the impact, right? We'll get midpoint surveys, we'll get final surveys. We will be able to look at claims to see, did we actually make a difference in terms of health outcomes? So definitely look out for that and look forward to coming back to share once we have a little bit more of that information. So that's one piece. And then, of course, we're thinking about if there are funds again, which we won't know until this summer, how do we continue to build from what we've done this year for 2026 and beyond?
That's exciting. There's the body of evidence that will come out of this thoughtful design will really be a very powerful policy capstone that can direct really how public dollars are invested back into families to drive outcomes that we all say that we want. So this is going to be a very powerful opportunity, I think, to direct a shift in how budgets are designed, how money is invested, and really what when we think about ROI on tax dollars, but then also the just health and wellness trajectory of Californians as a whole. We have to have some North Star about where we want to achieve in terms of health and wellness, especially for our kids. So that's really exciting work. I look forward to just having maybe a policy symposium or discussion about the powerful evidence that comes out of this. And I think one other element about what you shared, which is these funds were from a penalty fund from healthcare companies or insurance companies. And it's really interesting, and I think it's just a really indication of leadership as well that these companies came together and they were willing to appropriate these funds for this intervention. Just curious about just their sentiment about impact and the potential for them to possibly do more interventions with their funds. Is that something that they're thinking about?
Definitely. I think there's always, yeah, bring folks along. I mean, the plans help co-create the original program, which generated the funds. And so, we had a lot of conversation about the use of the funds, which were not going to be returned to them, but were going to be taken and invested in different ways. But multiple leaders from the health plans that we work with have said to me, you know what? Like we ended up in a really good place. We feel excited about where these funds are going, especially it's going to their members, right? It's their own members, and we're eager to see what the outcomes are. So I feel very grateful that we've got, especially in California, just a set of leaders who are willing to test and learn. And I do think if the outcomes are as robust as I am hopeful that they are, it may change internally what folks are thinking about in terms of quality, in terms of equity, in terms of how to do population health. And then, of course, I'm only one of the public purchasers. We have partners, across the state on the Medicaid side, the CalPERS side, who are also watching to see what have we learned. Are there opportunities for purchasers to do something different as well, and potentially require health plans to invest dollars in some different ways? So, yeah, I think Covered California has always thought of itself as potentially being a catalyst, and not, we're not the biggest fish. So can we generate enough information that it can help have others, philanthropy potentially, kind of figure out how to come behind to continue to sustain what we've learned?
That's exciting. It's such a huge opportunity to drive better outcomes systemically, which California historically just really influences the nation in their approach to many interventions. So I'm certain, Dr. Soni, that you are just in high demand across the nation as folks want to learn about the work that you all have delivered for your constituents. So kudos to you and the team.
I saw one more question, which I'll sneak in before we exit, which is, I think, a great one, which is looking back, would I do anything differently? And I don't think so yet. I think as we learn more from folks, we're meant to be nimble and responsive to what folks are telling us. And so I think there's potentially revisions that might get put in place for future years. But I'm both a little bit meticulous about design, and also I don't actually live life with a lot of regret. And so I'm moving to acceptance, pretty quickly. So I don't at this junction think that there's anything I would do today, but as we learn more, you better believe we will pivot based on what our enrollees tell us.
That's lovely. Thank you for grabbing that question. I needed to refresh my chat. Forgive me, friends with us here today. There's one more question that I'll pull from Paige, and it says, is any of the survey data and structure available for folks trying to perform this
Miracle.
miracle in their states or jurisdictions? Same for any ongoing outcomes and data. Yes.
Absolutely. The Cover California way, and you sort of joked at it, Asia, but really, I am really accessible to anybody, as is my team. We're happy to come anywhere that would be of use to folks. But yes, our real ethos is transparency about design, implementation, the numbers, the survey. So our landing page, which is public, has a bunch of information about the population health investments already. And as we start to get some of that information coming back in, we're happy to post it there too. So the survey tool it's a great push. We could potentially release it on our website even now, but if anybody wants it before that, we're happy to send it out to anybody who's interested.
Yes, lovely. So Dr. Soni is sharing all the data. And then relative to structure, Forward is here. You can contact Forward. We are able to really help you think about your design, really be a partner in just as you ideate your intervention, well before we are ever in official partnership. We just really worked with Dr. Soni and her team for many, many months before we really codified our partnership. So we're committed to the work of impact, and we understand how government works innately. And so happy to just be a thought partner as you think about impact, because it's exciting for us to just share the new tools that are available through technology to really help do the wonderful work of administering support to people and communities. So feel free to reach out to us. And some more questions came in. Lovely. Next is saw that Cover California reached record high enrollees this past open enrollment. How do you see Cover California leading and innovating in healthcare space, potentially leaving a blueprint for others to learn from? Wonderful question. And
Thank you for that
congratulations.
question. Yeah, such a good question. It's true. We have nearly 2 million folks. It was a huge open enrollment for us. And part of the reason why it was is because we started to address affordability in a broader way. So not just subsidies for premiums, but we actually eliminated deductibles for over 1 million folks in this plan year. We eliminated deductibles. I mean, that is better than many folks' employer coverage. So because of that, yeah, we correspondingly saw an increase in enrollment. And separately from my division, our amazing policy eligibility and research division, they're also doing randomized controlled trials at all time and publishing about what did we do to get that enrollment up? What's the crosswalk for that affordability? How did we maximize the funds to eliminate deductibles and reduce cost sharing? All of that actually is available on our website as well. Like this is part of our commitment to sharing information. So I think that's one thing is first of all, we're open source in a lot of ways. I think the other part, Hannah, is that we are an active purchaser. We don't believe that the cost of healthcare should be going up and up and up every year. And we sit down across from our health plans and negotiate that every year. We use our claims data to fact check things that are coming forward. I do think that that potentially could be a blueprint, right? If we are concerned about the health side, the affordability on the health side, we actually have a lot of tools already in place that could be scaled to other states, other lines of business, and frankly, the federal government as well. So, another open invitation. We're always happy to share what we've done, what worked, what hasn't worked, and then we continue to publish and release in academic journals as well as just on our website through white papers and memos.
Dr. Soni, you said it just so nonchalantly that you all eliminated deductibles. I mean, is that the first time this has ever happened in the United States of America?
I don't like to overstate, but I believe so.
Yeah, I've never heard of it before. That's why I asked
Yeah,
the question.
I believe so.
That's just groundbreaking, and just like another step toward just universal affordable care that every person deserves. So we hope that there are learnings and applications that could be adapted to the federal government as well, to ensure affordability and access to care. Exciting. Thank you, Paige, for that question. Just uncovered another nugget of wonderful data and leadership. Okay, I think that is the very last question. We're at time. Again, thank you, Dr. Soni, for your time, your leadership, and just making us encouraged about the future and the possibilities of government and impact for families. Dr. Soni's information is available. Follow her on LinkedIn. She speaks about her work many places, and I'm sure that she will continue to share the broad impact and the data as it is continued to be updated and released. For those folks that want to do innovative and amazing things, contact our team at Forward. We love solving challenges and really being a thought partner and how you're ideating, doing something new, powerful, impactful for your constituents. And I look forward to more of these amazing conversations. But this is the rainbow at the end of the hard work. Shout out to operations team and also all of the members of Forward that made this possible. And thank you all so much. See you next time.